those of you who follow my platform, you know I'm a licensed intimacy sex psychotherapist. So part of the things that I do is I specialize in sex therapy. And I wanted to talk and share in this video some misconceptions about sex therapy, because I've actually had people come in that wanted me to look at their penis or their vagina or some body part of theirs to see if it looked like it was functioning correctly or whatever. And I'm like, oh, no, I don't look at body parts. That is between you and your doctor. A sex therapist is not there to help you with any medical condition at all. So I do see people that are trying to have sex with body parts that are missing, or they feel, like they've been emotionally traumatized with a body part, or they feel frightened, or the way they were raised, there was chaos, there was abuse. But the medical doctor has to see you first and evaluate what's going on with you physically. And as a matter of fact, most sex therapists get their referrals from a medical doctor, an internist, sometimes cardiologist, sometimes oncologist, urologist, OBGYN. We work together. I'm mostly there to help you, the client, communicate about what is going on with you sexually, why you feel the way you do, and what your intention is, or what you want to help with, what part of this is a struggle. So basically, sex therapy is a way of communicating with you about what's going on, what happens when you try to have sex, why sex has not been successful for you. And so we're going to get all the facts, all the things you've tried, maybe if you've had an addiction or a porn addiction, or you feel like you're a sex addict, or you've been traumatized or sexually abused. These things all fall into that category. And sometimes different medications you take can make you unsuccessful with having sex, as can culture things, such as if you were raised in a very sexually taboo type of culture, that you weren't talked to about sex, it was considered dirty or nasty, then more than likely you are going to have trouble orgasming, engaging in sex, accepting the bid of your partner, wanting sex, and all of that understanding. How is sex therapy different from other types of therapy? Other types of therapy will address your situations, and mostly like what's going on with you, how were you raised, and they're mostly concerned with how you relate to others, not so much in a sexually intimate way. In other words, sex therapy is really more zeroing in on the intimacy, the emotional and the sexual, the very act of having sex together. What are the biggest misconceptions about sex therapy? So many people think that sex therapy is about improving like different positions, different performance status. It's about helping you have sex more frequently. It's about helping you masturbate more effectively, or, different ways that you can find positions that will, blow your partner's mind. It's more, actually, so many people have recreationalized sex that it's gotten very confusing when they come to sex therapy, because sex therapy basically is up to the therapist's discretion. But if you were to come to me, it would be about the sacredness of sex. And so really putting a lot of emphasis on that intimacy between the two of you, that sacred, safe space, protecting that, trusting that. Because without that, no matter what kind of sex you have, it is never going to be as fulfilling. Sexuality in a relationship is much deeper, much more powerful if the two people trust each other exclusively and are working together to protect this sacredness of sexuality. And with my counseling in dating couples as well, I like to start that right from the beginning. And the way you kind of create that space is you focus on the emotional intimacy more than the sexual intimacy. Who can benefit from sex therapy? I think everybody can. I think any of us can, because I think it's a topic, for the most part, we've been shut down with. We haven't been able to really talk about our sexuality, what we find sexual to ourselves. Studies have been done asking people what makes them feel sexual or turned on. And it's all over the place. For men, it many times was a naked body or a fantasy of getting naked with someone, of being their hero, of having sex with them. For women, it was all sorts of things, beautiful things in nature, flowers, bunnies, seeing someone's side of their face drinking water out of a fountain, watching and hearing different pleasing sounds out in the environment. So sexuality, and if I were to ask maybe someone from the country of Italy what was sexual, I may get feedback about the way we eat, the way the sweat was beaded up on their nose when we were drinking champagne and talking about one of our most romantic vacations, eating in bed. If I were to liken that to another country, I may hear something completely different. So a sex therapist has to know the faith you were brought up in, the country you were brought in, the primary language you were brought up in, what you saw your parents do together, how their faces looked when they were happy and in love. Did they hold hands? Were they demonstrative? All of these things are going to help a sex therapist help their client if their client is struggling in sex. And the benefits are, we know the benefits of having sex, and you don't need a lot of sex. You do need a lot of intimacy. You need a lot of intimacy every day. And within that intimacy, I include touch. Some people say, oh, no, not me. I don't like to be touched. Even if those people don't like to be touched, they do like intimacy. They like emotional intimacy. And touch, people who don't like to be touched, many times are telling us that the way they were touched, they didn't enjoy. Maybe it was forced on them, or maybe they felt like they never had a choice, or maybe they watched their parents very intuitively and saw their parents didn't like it. Many of these things can be personalized, and the child can grow up as an adult carrying that baggage from parents when they really were never able to talk to a sex therapist about where that came from or why they feel that way, or different exercises they can do with their partner that may help them get more insight into that. And I think lastly, is sex therapy one of the things I think every couple needs. I don't think every couple needs sex therapy, because I am from the belief that sex is about 10% of a healthy relationship, unless it's going badly. And then if it's going badly, then yes, both of those partners should see a sex therapist. And how do you see one? It's quite easy. You don't have to look and find them online. You talk to your doctor and ask them, do you know of a therapist that specializes in talking about intimacy and sex? When people come in to see me, this conversation is extremely intimate. We're talking about the way that person has expressed and loves another person. You don't get much more intimate than that. So it's very important, as a final point, that the sex therapist you end up going to, you really like. You really feel an affinity, and mostly you really trust that space you have with them during the session.